Hello, I'm Dr. Ananya Dhar. I'm a consultant psychiatrist. Welcome to my channel Psychognia Clinic, and in this video I'll be talking about caregiver tips for dementia. Dementia is a disorder in which a person gradually loses their memory and ability to do other things. It can be very difficult to live with as it affects activities of daily living, it affects the way you do. Our memory is very important in daily living. We have to remember to do things, we have to remember how to do things. And when all of this is lost, it can be very difficult for the person. If you live with someone who has dementia and if you're caring for them, here are some tips to make their life easier. Number 1, be patient. Sometimes, if you have spoken something to a person with dementia, they might forget it, or they might not understand it, or they might get irritable at you for no reason. Try to understand. This can happen to anyone. It's not their fault. They did not choose this. And sometimes you may have to repeat your instructions once or twice. You may have to explain things in a simpler manner. And you have to sometimes understand, even though they don't understand and they make some mistakes. That's okay. They deserve our patience, they deserve dignity. Second, use pill boxes. So, people with dementia can forget their medicines a lot of times. They might have other disorders like diabetes, hypertension, or their medicines for dementia, which they might forget to take from time to time. Also, they might have forgotten that they have already taken the medicine. Say one day if they have forgotten it, and they might take it twice, and so they get a higher dose of medicines. Now this can be prevented by using pill boxes. So you get these medicine boxes with Monday to Sunday labeled on them, and if you can take out the medicines for one day in one box, at least even if they have forgotten it, or even if they can't remember whether they have taken the medicine or not, they can simply check that, and on that day if it is finished, then they will know. It can help them. These pill boxes are easily available in most medical shops, so you can give them a try. Remind them to take their meals. So people with dementia can also forget that they have had their meals, or they might forget to have meals as well. So they might ask you that, okay, I've not had my lunch, even though they actually have. So to avoid any hypoglycemia or any such complications, please just make sure that they have had their meals on time. Number 4, keep them engaged. So it is very important to do activities, physical as well as mental, to keep your brain stimulated and your body health well. So physical activities can include light exercise, whatever they are able to do, some sort of movement. If you can check with their doctor if a type of activity is suitable for them or not. And exercise is not only physical, right? There are mental exercises also that prevent further degeneration of the brain, or further it keeps their memory processes and all the cognitive processes active. For example, simple puzzles, crossword puzzles, like Sudoku and all of those that are given in the paper, or whatever they like, they can do. Some simple board games like Ludo and chess and all of these can also be helpful. And on a plus side, it can increase the family time, it can increase the bonding with you. Physical exercise also releases a lot of antioxidants that acts as a preventive action for dementia. Keep photos of loved ones. So sometimes what can happen is that people with dementia start forgetting names, and they can start forgetting the faces of people around them, their loved ones, their family members, and then they feel they are confused and they don't understand who the people are with them, and this can cause them to feel confused. This can cause the family members to feel very hurt. So what you can do is that you can frame photographs and of all the family members and put a label on on them with their name and relation, so that and put them up in their room somewhere, so that every day they keep on seeing these photos and these names. It will jog their memory, it will keep them it will help them to remember who everyone is. You can also keep an album stored with photographs of all the important memories in their life. This is called as reminiscence therapy. This helps in them remembering all their life events, or like say their marriage, the birth of their kids, the first birthdays, all the important events that have occurred in their life. Labeling rooms. Sometimes people with dementia can forget which is their room, they can forget where the bathroom is, they can forget where the kitchen is, and they get confused inside the house. So what you can do is that label the names of the rooms for them. Also, in their personal wardrobe or belongings, if you can label the drawers, containing, okay, this is the medicine drawer, this is the clothes drawer, this is for this, and all, it can be very helpful for them. Make sure they are aware of the date and time. In dementia, sometimes people lose orientation of time. They get confused what day it is, what time it is, whether it is in the morning, evening, and this can lead to a lot of confusion and certain conditions like delirium. So to prevent this, always make sure there's a calendar in their room, or some digital device maybe displaying the date and the time, and day, date, year, all that things, and make sure that they look at that every day. Or you can casually mention today's Sunday, today's Monday, every day, so that they are aware of what time it is. Also, exposure to sunlight is very important. So if they are exposed to sunlight, for example, make sure that their windows are open, take them to the balconies, make sure that in the daytime they go out, so that they are aware, okay, this is daytime, okay, so that their day-night cycle remains intact. So this is also very important. Make sure that they are not staying indoors in a closed dark room all day. Make an information card for them. People with dementia can wander out of the house and they can lose their way. They might wander out, and if they are lost somewhere, they might not be able to remember the contact details of their family members or phone numbers or their address. So make sure at all times they have a identity card with their name, the fact that they are a person with dementia, the phone number, the emergency contact number, the address where they can be of the house, and all of these things written. Maybe preferably have it hanging around their neck, maybe on a badge ID, laminated ID card or something like that, so that in times of distress, some person can see that, can help them, can take them and contact their family. The last point is include them. Sometimes what happens is that people with dementia are excluded from family activities, and in India there's a lot of stigma around these, so people feel that it's better to hide them, or people better that they don't come out in front of guests, or they are not a part of celebrations. Not do that. Please include them in all celebrations and activities. Understand dementia can happen to everyone. It can happen to you, me, any of us. We didn't choose these. Treat them with love and dignity. So if you found this video useful or any of these tips useful, please let me know. If you have any further questions, you can let me know that as well in the comments below. Make sure to subscribe and share this video so that it reaches more number of people. If you want me to make videos on any other aspect of mental health, please let me know that as well. Thank you for watching.